Hi, this is Robert Masterson, and this is my film project assignment, and I'm working solo. The movie title is Good Will Hunting, and the main character is Will Hunting. Will Hunting is an underperforming genius, and he spends a lot of his time drinking, working in construction, going to the batting cages, and getting into fights. And he eventually is sent to prison, in which he's bailed out by a professor and he forces him to go to therapy and work under the professor doing math for bailing him out. And we also come to find that Will has a very traumatic past, which was mostly due to his childhood and abusive father. This film takes place in South Boston, more specifically the MIT Harvard area, and the atmosphere and culture is real gritty, working class, because Will's in a blue-collar, poor neighborhood, which he spends a lot of his time working construction. But there's also an academic culture that arises because there's time spent in MIT around professors and really intelligent students and professors. The time period is in the mid-1990s, which is apparently a time of strong class divide and emphasis on education and opportunity in South Boston. I am diagnosing Will with post-traumatic stress disorder, and this disorder is associated with exposure to trauma, like abuse and violence, and often associated with military experience specifically, but it's most typically seen in young adults in low-income families, but it can also affect anybody, not just that group, but that group is the most common that suffers. The film's diagnosis is actually that I believe the film would diagnose Will with PTSD. He actually does go to a therapist in which his trauma is harped on. He isn't specifically diagnosed with PTSD, but I think that was where it was pointing to, that he did have PTSD. And it wasn't a time period where mental health was ignored. It's a time period where it's taken seriously, and which is shown through the therapy and the therapist really trying to help Will work through his trauma. And culturally, PTSD is acknowledged because trauma is all over the world, and PTSD symptoms are seen in all sorts of different countries. So that's just something that nobody can ignore, and it is just a disorder that is recognized globally. Some stigmas around PTSD are that it's only associated with military and suffering from mental health because they're in a violent military situation, which can be a result of social media portraying PTSD as just military flashbacks due to loud sounds, which does happen and is a serious issue, but sometimes doesn't encompass all the ways that PTSD can be experienced in other traumas. And yeah, that's a stigma around PTSD. Some evidence of Will's symptoms can be seen in his avoidance and angry outbursts, which are two major symptoms of PTSD. This avoidance can be seen in how Will pushes people away and refuses to talk about his past. A very clear incident of this is when his girlfriend Skylar tells him that she loves him, and this just causes Will to freak out because he does not want to be attached to someone and have someone be very close to him. So he pushes her away, yells at her, tells her she's out of her mind for saying something like that. And yeah, it just shows his avoidance. Will is also prone to angry outbursts in which he turns violent. This is an image of him punching somebody for a fight, and Will is just prone to these violent outbursts, which is another symptom of PTSD. Will's weakest symptom is his flashbacks. This isn't really seen in the movies when something really ignites a serious flashback. My plan for treating Will would be to send him to therapy, and this would be an appropriate treatment because it allow him to process his trauma and learn some coping skills to this trauma and these issues. But I would not give him anti-anxiety medication. I feel this wouldn't attack the root cause of the problem, and I just think the most important thing to do would be to send him to therapy to work through his trauma. Some ethical concerns of this would be forcing Will to go to therapy, which is seen in the movie in which he's forced to go, not on his own accord. This could raise some free will issues, but aside from that, the actual treatment of therapy doesn't really raise many ethical concerns. Although Will does not receive therapy, it is under very strange circumstances because he is in a society in which, like around blue-collar more gritty working class people who don't necessarily view mental health as very serious. So this would be a cultural barrier as being seen as weak if you're going to therapy, which is just a barrier that is seen all around the world sometimes. But specifically in this movie, in Will's environment, he would likely be seen as weak. And I just would find it rare for him or any of his friends to go to therapy on their own accord, because it just isn't something that they would do as working class type of people. In the broader perspective, this film does portray PTSD in a very accurate way, because it reflects two major symptoms of PTSD, which are avoidance and anger. But it is also a relatable environment, and Will is more or less a very average person aside from his intelligence. But yeah, it can be a relatable situation that people can, really learn more about PTSD in a way. And this also adjusted my own view on PTSD, because I was a victim of that stigma associating it only with military issues, but now I recognize how it can be seen in many different ways through trauma, childhood, serious issues outside of that. And that is all I have. Thank you for listening.